occurred in a wooded area. The rider is laying in the woods. It is cloudy with a chance of rain. Temperature is 38 degrees.
Okay, arriving on scene, BSI, scene safe, we got gloves.
Scene is safe. Deputies are up controlling traffic by the road.
We do have deputies. How many patients do we have?
Just the one.
Based on the mechanism of injury, I'm going to request ALS. And based on general impression, I might be escalating that type of support. Okay, so arriving on scene, where's my general impression? What do I see?
One patient.
One patient. And is my patient responsive to the APU, alert, and wait?
Talk to your patient.
Ma'am.
Hi.
Hi, okay, and so I have excessive external bleeding, correct?
You do.
Ma'am, I'm gonna need you to grab a tourniquet, put in your pocket, grab some sterile dressing, please. And I have gloves on at this time. Am I able to stop the bleeding with my hand?
No.
Okay, so we're gonna apply pressure and sterile gauze to this, what appears to be a amputation. Okay, ma'am, can you hear me?
Yes, I can hear you.
Okay, so she's able to speak.
Yep.
I'm going to, can I ask one of the deputies to come down here, please, and hold C-spine?
They said there's only one of them on scene right now.
Oh, what a shame. Okay,
Yep.
so after she, you don't have to put the splint on yet. We're gonna ask them, so based on the pressure that Pam's holding on that wound with sterile dressing, is the bleeding stopped?
It's still bleeding.
It's still bleeding. Now apply the tourniquet, high and tight, proximal to the injury. And so I'm gonna maintain, we're gonna get that bleeding stopped. We're gonna suspect C-spine injury. My partner's gonna take over that here in just a minute. And so what do I notice about her chest rise and fall as far as breathing?
Equal,
Equal
good rise and fall.
Rise and chest fall, and she is able to respond to me, so I have
Yep,
a
yep.
airway.
Yep.
Ma'am, what happened?
I was writing and a deer came out.
And C-spine on, manual C-spine on her, and a deer came out?
Yeah.
Okay, based on the fact that her helmet appears, is this helmet true to what I'm seeing on scene?
No, it's got some scratches. Some
It
dirt.
does have scratches?
Yeah, scratches, dirt, all the way around it.
Okay, we are going to keep it on there for, does it keep us from being able to hold C-spine?
No, you can hold
I can hold
C-spine.
C-spine. So just like Pam did, we removed that glass so that way it doesn't occlude her airway. And do I notice any discoloration, raccoon eyes?
No signs of basilar skull fractures.
No, okay, you know where it's going. All right. so
No
just hold
periorbital
C-spine just for a second.
bilateral ecchymosis, no.
Okay. And how about her pupils?
They're equal responsive and 4 millimeters.
4 millimeters. And ma'am, what happened?
I was writing and a deer came out.
A deer
and
came
I
out?
swerved.
Okay, do I notice any other signs of excessive bleeding?
No excessive bleeding, no. You do
Okay.
notice abrasions where you see skin and her clothes are roughed up.
I'm gonna make note of that.
Yep.
But based on the type of mechanism injury, with consideration for the patient, I do wanna trauma NACA her. Do I notice anything else
Just-
after exposure?
Just the abrasions.
Okay, I'm leaving the helmet on, because that does not seem to be affecting us at this time. And so, ma'am, can you, with your good hand, can you squeeze my fingers? Okay, do you feel this?
Yes.
Okay, what is her cap refill?
2 seconds.
2 seconds. 2 seconds. Ma'am, is there anything hurting you right now?
My arm,
Anything else?
no.
All right. What is the pulse? And I want a distal. Obviously our shoes are off. It's our pedal pulses. Do we have?
You have pulses on both, equal pulses on both sides.
Okay, push, pull, push, pull. Okay. And what we're going to do is we're gonna initiate rapid transport. And so we have, what I noticed about our skin,
Pale, cool, and clammy.
pale,
Yep.
cool, and clammy. We are going to install a manual C-collar. Am I able, do you have a back?
It's in your compartment there on your
Okay.
ambulance.
Am I able to get a C-collar on with this helmet on? Or are we gonna physically, okay.
Yeah.
Ma'am, if you maintain C-spine, that would be great. And I'm gonna have you install a collar if you may. If not, we're gonna have to carefully remove the helmet. Velcro does not work. So it does not appear that we're gonna be able to get this collar on. Do you feel as if though we will?
No.
Okay. What we're gonna do is we're gonna have to, hold C-spine, you're gonna lift that helmet off her face, I'm gonna come up in here. Ma'am, I'm gonna hold your, neck and keep it stationary while she lifts the helmet. We don't have anything over the nose, so you shouldn't have any trouble there. Okay, and when you're ready, I want you to take C-spine.
Oh.
Or you can go ahead and put the collar on.
Sure.
If you wanna measure, I feel 3 fingers.
You feel 3? Okay, thank you.
Ma'am, are you doing okay? Okay, we're gonna get you loaded up just here shortly, okay?
Okay,
Can you tell me, let's see, do you have any allergies?
no,
Do you have any medications you're taking?
no,
Have you had any surgeries or any medical history?
no,
And, I understand that you, deer ran out in front of you, correct?
yes,
Okay. Alright,
Does this feel comfortable? Is it hurting your airway?
no,
Is it a little too tight or a little,
it's a little tight.
okay, no worries.
they'll all say that, right?
Is
Alright,
that feeling okay? Okay. I
can you
got
maintain
C-spine.
C-spine?
So now that the collar's on, the spare deputy came down and he's
Oh,
holding
nice
C-spine.
guy.
Or a firefighter showed up and knows how to
What?
hold C-spine.
Alright, so what I'd like to do is we're gonna check our PMS again. Can you squeeze my fingers? Can you feel this?
Yes,
What finger am I touching?
my right index finger.
Alright, ma'am, can you tell me what day it is?
Saturday the 14th,
And what's your name?
free,
And who's president?
strong.
Okay, can you pull, go ahead.
Do I feel any, bleeding or hematomas or wounds behind
No.
her head right now, or
Nope.
her neck?
You
Okay.
do not.
Okay, we're going to get her in the ambulance and based on our tourniquet that our bleeding stopped.
Your bleeding is stopped.
Okay, I was gonna apply a second one if not. Okay, so we're gonna get her onto a backboard because I suspect some form of spinal injury, things that I'm gonna be taking care of.
We should
And
go from this side since her
We can.
arm is kind of over here and we can just leave that one up.
yep, that's fine. What we're gonna do is make sure the arm comes with us. We do not have a bag big enough, but it is
That's fine.
coming with, whatever the packaging that we have for this arm, it is coming with us.
Okay.
And-
You can set it out of the way if you
Okay.
need to. 'Cause
Tammy's gonna move her,
Something.
what would be arm, and so we have a deputy holding C-spine. What I'm going to do is check, we just checked PMS prior to loading on the backboard. When we get her up, we're gonna check her back for step off or crepitus.
Her arms.
Okay. You
Sorry.
just loosen it up.
And so I'm going to have you put this arm over top of here, and I'm going to lift right here, and when I lift her up, Pam, you're gonna follow me with the backboard, inspect her. I don't have anything grab right here. And we're gonna inspect her back, are we
Do
good?
I feel anything, any abrasions, any contusions on her butt, on her legs? on
Back
her
is all
butt?
normal.
Okay, and we're gonna lower her down. All right. And based on the fact that we're not evenly distributed on here, we're going to pull down and then up, and the person holding C-spine is doing a call, which is deputy, but we'll simulate for now. Ready, go? Okay,
Sorry,
so we are on the backboard. I'm gonna check PMS. Can you pull? Can you push? Can you pull? Can you push? Can you squeeze? What finger?
Index.
Index. Straps.
how is her skin?
Pale, cool, and clammy.
You go ahead and put straps on if you don't mind.
Nope.
Okay,
I'm gonna go
on,
ahead and do this.
yes. Ma'am, on a scale of 1 to 10, how would you rate the pain in your arm? 10 being the most pain you've ever felt in your entire life. On an 8, okay? What is our pulse oximetry?
Once you're able to, you just put it on.
I just did.
95.
95. And so I'm considering just flowing at 2 with a nasal cannula when we get into the back of the box. Has my respirations changed at all? Or what are my equal rise and chest fall? What's our respirations?
You got good equal rise and fall. Respiratory rate is 32.
32. Okay, and my lung sounds?
They are clear bilaterally.
Clear bilaterally. Manual blood pressure on the arm that she has.
You said a manual pressure?
Using this cuff. I'm not
Oh,
in
you
the-
oscillated?
Yes.
110/56.
110/56. And you gonna run that side for the straps?
Yes, I'm good on
Are
the
you,
straps.
are you good on the straps?
Yes,
Okay.
I got
We are in the
both
back
at
of
the
the
same.
ambulance at this time.
You are 1 you get her strapped down, you're able to move.
I got it up and, above the,
There.
this.
I see we got our arm in here.
Yes, I do.
This
Sorry.
should, she's so small. Sorry, you're so short. The straps did not come out.
Evenly.
Is there a hole here?
Yeah.
Yeah, we are once.
We want this
Oh,
one
really?
over
Yeah,
her
good.
stomach and then we want this over her chest. Good?
And we do have sterile dressing on this wound,
Yep,
even though
yep,
the tourniquet's there.
Are
Dressed
you gonna
up.
do the big one? You ready to do it together? Got it.
And once she's in here, we're gonna check her out PMS. Now that she's strapped in. Is she still adequate, rise and chest fall?
She is.
Okay. We're, go right there. She's, significantly shorter than anticipated.
But
So,
if you start at the shoulders and go that way, you
I wanna be.
you don't run out.
We would correct this in the field, we'd go down one more, but.
Okay.
Okay, so PMS, can you squeeze my hand? What finger am I touching? Index. Can you push? Can you pull? Okay. And so she's alert and awake. Her AVPU is intact, and we're in the back of the ambulance at this time.
Yep.
Has ALS came back yet?
They are. Are you moving yet?
We are in the ambulance moving, yes.
Okay. Connor's driving, both of y'all in the
Okay.
back, and he goes, "Hey, here's your medic.
Awesome.
What you got?"
All right, so we're gonna hand off the care to the medic, and we're gonna support the medic. And so what we have, and what is our radial pulse right now in our arm is good? We're hooked up to the monitor, and what is our blood pressure?
Actually, the medic's not here yet.
Okay,
He
medic
said,
has
"Hang on a
left.
second, I gotta take a call from my wife real quick."
That's fine.
He
Okay,
steps out. So, earlier you said you were considering O2. What did you
Yes.
decide on that?
we put a nasal cannula for patient comfort at
Okay.
2 liters per minute. It's not absolutely necessary based on our SpO2, but I like to do that to get ahead of it in case we lose ground. Now that we're in the ambulance, I'd like to hook her up to the monitor. And so with blood pressure in the ambulance and we're moving down the road and we're going to a trauma center, what is our blood pressure?
110/60.
110/60. What is our blood glucose? Would you like me to demonstrate in getting that out of the bag?
104.
104. Lung sounds now that we're in the ambulance.
Still clear.
Still clear, equal bilateral. And what is our heart rate?
104.
And 104. And I put a cap no on top of that nasal rebreather. What is our cap no?
It is 35.
35. I'm going to do a more, and that's an adequate number. I'm going to do a more in-depth. Do we have alert and responsive still?
Mhm.
Any change in LOC?
Mhm.
Okay, ma'am, are you still
she's
okay?
asking- answering
How's your
questions.
arm feel?
It still hurts.
Out of 1 to 10, 10 being the highest pain, where are we at now? 8, and I'm an EMT, so that's all you're gonna get. So, what I need to do is I'm gonna check for decaf BTLS. Do I notice anything around the eyes at this time? Do I notice anything around the ears?
Eyes, ears are good.
Nothing draining out of the ears?
There's nothing.
All right, do I notice any other bleeding that's occurred? I'm not worried about the abrasions right now.
No.
Okay, I'm gonna check her chest. Do I find any crepitus at the clavicles or the ribs?
No crepitus. Good rise and fall.
Palpation on the abdomen and 4 quadrants. Do I
Cool.
notice distension?
Everything's good.
Does she respond to any pain?
No moaning or groaning to any
Okay.
pain.
Pushing down on the hips, do I notice any crepitus?
Pelvis is stable.
Pelvis stable. And her femur, do I notice any deformities?
Both lower extremities are intact, just some abrasions.
Fib, do I notice any deformities?
Nope.
So I'm checking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling through that procedure to include the arm that she has and her feet.
And the only thing you note is the abrasions, other than the amputated left arm.
Okay, and I'm satisfied at that point. So how far are we from the hospital?
Sorry, had to get off the phone. What you got?
Okay, so medic, I have a patient who was involved in a motorcycle, or moped, accident, deer ran out. She's been ejected from that. We have installed we established manual C-spine, installed a C-collar. She's on nasal rebreather at 2 liters per minute. She has an amputated arm that we've treated with pressure dressing, or with sterile dressings that was not able to control the bleeding, so we installed a tourniquet. On that tourniquet, we wrote the time of which it was done and the name of the patient. And at this time, she is on a backboard. We have blood pressure of 110/60, blood glucose over 104, and she has equal bilateral rise and chest fall. Her heart rate is 104, and she has 35 cap no. She does not have allergies, and she is not on medication.
Sounds good. I'll take over the patient. And I know you said you were going to do something with the arm. What are you going to do with that bad boy?
That thing is coming with the hospital with us, with the possibility of we're going to Trauma One Center, and they may be able to install it. What's that?
How are you going to package it? How are you going to bring it with you?
We're going to keep it cool, but not directly on ice.
Okay. That's fine.